Why is an embryo biopsy used for genetic screening? Imagine you are planning a family and want to make sure your future children are healthy from the start. You might hear about embryo biopsy as a way to check the genetic health of an embryo before pregnancy. But what exactly is it, and why is it used? An embryo biopsy is a procedure where tiny cells are carefully taken from an embryo during its early development. This usually happens when the embryo is at the blastocyst stage, around 5 to 6 days after fertilization. During this stage, the embryo has a structure called a blastocyst with an outer layer called the trophectoderm. Cells are gently removed from this layer, which will become the placenta, not the baby. This method is preferred because it causes less harm to the embryo compared to earlier methods. The main reason for doing an embryo biopsy is to get genetic material for testing. This helps identify if the embryo has any genetic or chromosomal issues that could cause health problems later. For example, some embryos might have missing or extra chromosomes, which can lead to miscarriage or birth defects. Testing can also look for specific inherited conditions like cystic fibrosis or Huntington's disease. There are different types of genetic tests that can be done after an embryo biopsy. One test, called Preimplantation genetic testing for aneuploidy, checks if the embryo has the right number of chromosomes. Another, called Preimplantation genetic testing for monogenic disorders, looks for single-gene diseases. There is also testing for structural chromosome issues, like translocations. All these tests requiring cells from the embryo to give accurate results. Using a biopsy at the blastocyst stage is better than earlier methods. Earlier biopsies, taken from embryos at a very early stage, could harm the embryo because the cells haven't yet specialized. Removing cells at this stage can also give more genetic material to analyze, making the results more reliable. This helps doctors identify the healthiest embryos for transfer, increasing the chances of a successful pregnancy. Families benefit from embryo biopsy because it helps select embryos with the best chance of developing into healthy babies. It reduces the risk of miscarriage by choosing chromosomally normal embryos. It can also shorten the time to pregnancy by increasing the likelihood of success with each embryo transfer. For families with known genetic conditions, it helps prevent passing those conditions to their children. Safety is a key concern, and research shows that when done properly at the blastocyst stage, embryo biopsy does not significantly harm the embryo. Modern techniques are very precise, and the embryo can continue developing normally after the cells are removed. This makes embryo biopsy a safe and effective tool in family planning and reproductive choices. Overall, embryo biopsy offers families a way to make informed decisions about their reproductive health. It provides important genetic information before pregnancy, helping them choose the best embryos to transfer. This process supports healthier pregnancies and healthier babies, giving families peace of mind as they plan their future.